Hi, my name is Shakira, and today I'll be your student nurse. Today I'll be performing musculoskeletal assessment. Can you tell me your name and date of birth? Now I'm going to assess your level of consciousness. Can you tell me who you are, what's today, and who's the president? Patient is alert and oriented ×3. Mood is pleasant. On a scale of 0 to 10, 0 being no pain, 10 being the highest pain, can you tell me your pain level? No pain noted. Do you use any mobility aids such as wheelchairs, walkers, canes, or crutches? Do you use any medical equipment such as IVs, O2s, ostomies, dressings, subconscious devices, or specialized mattress? No medical equipment or mobility aids noted. Now I will state the vitals. Blood pressure is 90/60 to 120/80. Temperature is 96.8 to 100.4. Respiratory rate is 12 to 20 breaths per minute. Pulse is 60 to 100 beats per minute, and pulse oximetry is 95 to 100%. Now I will observe your gait using 4 tests, which is normal walking, tandem, which is heel toe, tiptoe, and then hill walking. Gait is smooth, steady, and coordinated. Patient is able to walk in a straight line without losing balance. Now I will perform the Romberg test. If excessive swaying is noted, I will stop the test by placing my hand on the patient's shoulders. So the Romberg test is patient closing their eyes and standing like this. Patient is able to stand in a straight line without excessive swaying for at least 5 seconds. Now I will inspect the posture of the patient's back for body alignment and symmetry in a lateral and posterior view. So lateral is the side and posterior is the back. Now I'll palpate the spine for scoliosis, which is a curvature of the spine. And now I will palpate for any tenderness. Do you feel any tenderness? Head is erect. Hips and shoulders are equal bilaterally. No scoliosis noted, which is a lateral curvature of the spine. No tenderness noted. Now I will inspect and palpate the extremities for any colors, hydration, scars, rashes, bruises, or lesions in IVSS site. So I will inspect and palpate the skin. Color is normal for ethnicity. Skin is warm and dry. No scars, lesions, rashes, bruises, or IVSS site noted. Now I will palpate the muscle groups for size, symmetry, and tone. So that would be the shoulders, the chest, the abdomen, the biceps, triceps, forearms, the thighs, hamstring, and calf muscles. Muscles are firm, smooth. Yeah, muscles are firm and smooth. Now I will assess the muscle strength, which would be the hands. So I will have the patient push and pull against my hands. The biceps, triceps, and then I'll have the patient push and pull with her legs, his or her legs, and ankles. Muscles are strong and equal bilaterally. Now I would test range of motion. So the shoulder, flexion extension of the elbows, flexion extension of the wrists, supination and pronation of the forearms, hands, flexion and extension of the hip, flexion and extension of the knee. So I will hold the knee. Dorsiflexion is the toes pointing up, and plantar flexion is the toes pointing down. Patient has full range of motion, no tenderness or swelling, no crepitation noted, and crepitation is the clacking of the muscle joints or clicking. Now I will palpate the radial pulse and pedal pulse. So radial will be the wrist. And then pedal pulse will be the foot. Rate and rhythm is regular. Amplitude is strong. Radial and pedal pulses are 2 points. The range is 0 to 4 points, with 2 points being normal. And now I will assess head distribution and edema. So I will look at the arms and the legs. No hair distribution noted or edema. If I was to see no hair on the legs, that's poor circulation. And edema is swelling, which is excessive fluid volume.